More money for mental health now. The state is investing $1.35 million into crisis co-responder services, which deploys trained teams to behavioral health emergencies. Only 3 North Carolina cities are getting funding, including Burlington. WFMY News 2's Hunter Funk explains how it's helping keep people out of jail and giving them options for help.
In North Carolina jails, serious mental illness affects 15% of men and 31% of women. 85% of the people in prison have a substance use disorder or were arrested for a crime related to substance use. This is where Burlington's crisis counselor is working to change the statistics.
In my 3 years in this position, we have had no arrest when I've gone out on scene.
Samantha Mitchell is Burlington's crisis counselor. If there is someone who may want to harm themselves or others, is under the influence, or is disoriented, she comes to the scene. She says last year she responded to more than 400 calls for service, not one ending in an arrest.
I mean, there's been plenty of situations where it doesn't even come out as a crisis. Maybe it comes out as trespassing or breaking and entering or a medical assist, and they'll call me out there and I speak with the individual and we find out that there's more to the situation. I'm able to speak with them and we're able to look at hospitalization. We're able to try to avoid them being arrested, right, and having to go to jail.
She says the service was implemented nearly 8 years ago. This additional funding will allow them to hire an additional responder for overnights and continue to expand their current program.
The data's there, right? The more people we can reach out to, the more we can help and the more we can try to avoid those instances in the future where we have crisis.
This investment is part of North Carolina Department of Health and Human Services' effort to transform the crisis response system to ensure North Carolinians have someone to call, someone to respond, and somewhere to go for care.